Hi everyone, good afternoon to each and everyone. Welcome back to live session from Tiju's Academy, Thiruvalla branch. And this is me Abia from Tiju's Academy. Okay, so we'll start today's session. നമ്മൾ already പറഞ്ഞിട്ടുണ്ടായിരുന്നു I'll be doing a live session based on this Saturday's examination. Last minute preparation basisൽ നമ്മൾ ഇന്ന് ലൈവ് ചെയ്യും എന്ന് പറഞ്ഞിട്ടുണ്ടായിരുന്നു. So we'll wait a few seconds for our participants to join. നമുക്ക് കുറച്ച് നേരം വെയിറ്റ് ചെയ്യാം. We'll wait a few seconds so that our participants will join together and we'll start the discussions all together. Okay. So if you are having any concerns regarding your speaking module, you can comment it down and I'll be discussing on that. Okay, നമ്മുടെ ലാസ്റ്റ് മിനിറ്റ് പ്രിപ്പറേഷൻ ഇപ്പോൾ നടന്നുകൊണ്ടിരിക്കുകയാണ്. ആൻഡ് ദിസ് സാറ്റർഡേ May 18th we will be having OET examination and our students are in a rush, in a hurry to do all the things and look all the notes and everything. അവർക്ക് പറ്റുന്ന രീതിയിൽ ലാസ്റ്റ് റിലാപ്സ് അവർ ചെയ്യുന്നുണ്ട്. സോ എന്ത് ചെയ്യാണ് നമുക്ക് നോക്കാം വാട്ട് we'll discuss എങ്ങനെ എന്തൊക്കെ ചെയ്യണം once we enter into the examination hall, what we need to do എന്നൊക്കെയുള്ള കാര്യങ്ങൾ എന്ത് ചെയ്യുക നമുക്ക് ശ്രദ്ധിക്കാം നോക്കാം. So we'll wait a few seconds for our participants to join. Hi Shruti, good afternoon. So I hope everyone is well and fine. And if you are having any concerns regarding your speaking module, you can comment it down and we'll be discussing on that. All right. So we'll wait a few seconds so that our participants will join. Okay. So എല്ലാവരും പ്രിപ്പയർ ചെയ്യുന്നുണ്ടോ? നന്നായിട്ട് പ്രിപ്പയർ ചെയ്യുന്നോ? Are you practicing well? I hope everyone is practicing their speaking subtest. Okay, we'll wait a couple of seconds for our participants to join. If anyone is having any concerns regarding your speaking subtest, if you are having any doubts regarding your speaking subtest, you can comment it down and we'll be discussing on that. നമ്മളത് ഡിസ്കസ് ചെയ്യും and നമ്മൾക്ക് നോക്കാം എന്തൊക്കെ ചെയ്യണം during the examination time, what are the things that we need to carry, we need to follow എന്നൊക്കെയുള്ള കാര്യങ്ങൾ നമുക്ക് നോക്കാം. Okay. Okay, Hina, I'll speak in Malayalam. English. Many of the students are from many parts of the state and all. So I'll speak in English only. Okay. Okay, so we'll move on to today's session. That is what we need to do or what we need to focus on as we are moving towards our last minutes for our OET speaking. So first of all, we need to have that confidence in our speaking because having confidence is another level of thing that we can be done while we speak. Because when we have that confidence, even if we are saying a wrong thing, we'll have that confidence in our face and we'll have that confidence while we speak and we won't get stumbled when we say any wrong things or something like that. So always make sure that you are having that confidence in you. I know you are really tensed about the examination, you are really worried about the examination, you don't know what type of case that you'll be facing or what type of role play you are gonna do and how your interlocutor will be. You'll be having a lot of questions in your mind and you'll be really distracted. So what you can do is you have that confidence, you have that self-confidence. You need to have that because only with the self-confidence we'll be able to speak properly. So first and foremost thing that you need to have is of having a self-confidence. Okay, so ആദ്യം നമ്മൾക്ക് എന്ത് വേണം? self-confidence വേണം. Then only you will be able to speak confident ആയിട്ട്. Clear അല്ലേ? So be confident enough while you speak. Second thing is that while you get your role play card, don't just read it. Try to understand what each and every word says. Try to understand what each and every sentence says. We do have many role plays, we do have many types of role plays, and according to that we need to adjust, or we need to organize our starting, our ending, and everything in between, what we need to say, everything we will work according to our scenario and our role play card task and all. So always make sure that you are speaking it or you are preparing it properly. Make use of your 3 minutes preparation time, because during preparation time I have seen many students, they'll just read and go, and after that when the 5 minutes speaking starts, they will again read it, they will understand what the sentence is, and then they'll talk. So what you need to do is, do prepare and do all the questions within that 3 minutes of time. നമ്മൾക്ക് 3 minutes ടൈം കിട്ടിക്കഴിയുന്ന സമയത്ത് നമ്മളുടെ ക്വസ്റ്റ്യൻസ് ആൻഡ് അവർ ആൻസേഴ്സ്, ഓർ അവർ അസംഷൻസ്, അവർ ക്വസ്റ്റ്യൻസ്, അവർ ഫോളോ അപ്പ് ക്വസ്റ്റ്യൻസ്, എവറിത്തിങ് നീഡ്സ് ടു ബി പ്രിപ്പയർഡ് ബൈ ദാറ്റ് 3 minutes of time. And after that 5 minutes, since the 5 minutes timing counts, അവിടെ 5 minutes കൗണ്ടിങ് സ്റ്റാർട്ട് ചെയ്യുന്ന ആ സമയം തൊട്ട് we need to speak till the end of the 5 minutes. Okay, exact 5 minutes we need to speak, and according to that we'll get our marks. They are assessing how we are managing our 5 minutes of time with the patient. So always make sure you are continuously speaking for that 5 minutes in accordance to the response to the patient, in accordance to the response to the person who is sitting in front of you. You need to speak. And first of all, what you need to look is, you need to look for the setting where this thing is happening, this role play is happening. We need to look on that. Then we need to look whether our designation is given or not. We need to look on that too. Then we need to look on to what's the patient's concern. എന്താണ് പേഷ്യൻ്റെ കൺസേൺ, we need to look for that. And after that patient's age and all. Then we need to look on to whether the patient is having any symptoms, is it a known case, unknown case, what's the scenario, each and everything we need to find it out. And after that, by finding whether it is a known case or unknown case, we need to set up certain questions. There will be questions that we need to ask. There will be hint points, or the bracket thing there will be there. So we can just make questions from that hint itself. Okay, so if they have given find out and in bracket they have given any allergies, symptoms, signs, and all these things have been given. So you can directly just ask, well, I would like to ask you some questions in general, so shall I proceed with that? I would like to so do you have any allergies, any symptoms, anything like that? You can ask according to what the hint has been given. Okay, so then what we need to do is, we need to focus on our task, what the patient says. So when even today I had a student who when I asked about one question, she or he was like saying or giving explanation for other thing. So it is not appropriate. Once the patient, you have asked the concern to the patient, you have asked whether you have any concerns or not, and the patient has given their concern, patient has said their concern. So you need to address that concern first, and after that only you need to go to next task, or whatever the next thing is, then you can go to the next thing. Otherwise, it is very important that you follow the correct order. Like when we ask for a concern, the person, of course they will say a concern, maybe they might not give a concern, or they will not say any concerns, but endana once they have set the concern, we need to make sure that we address that concern. നമ്മൾ ആ കൺസേൺ അഡ്രസ് ചെയ്യുന്നുണ്ട് എന്നുള്ള കാര്യം we need to make sure. Clear അല്ലേ? So is that clear to everyone? Okay. So after that, then what we need to do is we need to go to the task accordingly. One by one we need to move on to the task where we'll be able to slide, we a quick transition or a smooth transition should be there from one task to another task. That means when we need to connect all the tasks all together. By that connection, a smooth speaking will be there. അതുകൊണ്ട് എന്ത് ചെയ്യുക, we need to connect the task and we need to have a smooth transition or a smooth moment in between each and every task. The person or the patient does not think that they are jumping from one thing to other thing. You don't give a chance for that thinking to the person അല്ലെങ്കിൽ the patient. ഓക്കെ, ഒന്നിൽ നിന്ന് മറ്റൊന്നിലേക്ക് ചാടി ചാടി പോകുന്നു എന്നുള്ള ഒരു ഫീലിംഗ് എന്ത് ചെയ്യില്ല. We are not supposed to make that feeling അല്ലെങ്കിൽ create that feeling for our patients. And the next thing what we need to do is avoid commanding words. Must, should, have to. Okay, and have to and need to is bit okay if the situation is like that. According to the tone we can say have to and need to. Otherwise must and should be completely avoided from the speaking. And make sure you, when you prepare for the role play, you are having a complete idea regarding the role play. നിങ്ങൾക്ക് അതിനെപ്പറ്റി ഒരു complete idea ഉണ്ടെന്ന് make sure, because as I've already said, many students will read the task in between and after understanding the task they are okay, we can do this എന്നൊക്കെ പറഞ്ഞ് like that they will speak. So in order to avoid all these things എന്ത് ചെയ്യുക, നമ്മൾ appropriate ആയിട്ട് we need to analyze the appropriately and we need to speak accordingly. Is that clear to everyone? Then what you need to do is, during our role play, don't use an unnecessary gestures, don't use unnecessary sounds, don't speak or don't make any other noise or any don't speak any other language, because it's really important that this subtest is to assess your English proficiency. Once your interlocutor has started your recording session from the end till the beginning, from the beginning till the end, you need to be in an English or you need to speak in English only. That is really necessary and that is the appropriate thing that we can do while we are sitting for an examination hall, because they are assessing our each and every moment and our role play and our speaking and everything. So it is very necessary that you are speaking in English only. Is that clear to everyone? And the other thing that I would like to say is always give priority, give that high priority to our patient itself. So because what the patient says is ultimately the thing. If the patient is refusing for anything, then you need to respect their decision, or otherwise it is not appropriate to talk harshly to the patient or make a deep toned voice to the patient or make a commanding tone to the patient. It is not appropriate while we speak. So always make sure you are polite, you are lovable, you are a caring person to the patient, and we always need to accept and respect their decision. പേഷ്യൻറ്റിൻ്റെ ഡിസിഷനെ ഓൾവേസ് അക്സെപ്റ്റ് ചെയ്യാൻ വേണം, റെസ്പെക്റ്റ് ചെയ്യാൻ വേണം. സോ ദെൻ ഓൺലി we will be able to speak properly. Then as I've already mentioned, once our role play card is in front of us, make sure you enter all the details correctly and you sign the details correctly. And after that we'll be having warm-up sessions also. So for the warm-up sessions, usually we do have a set of questions or set of answers for all the warm-up sessions or the warm-up questions, right? So we know how we need to speak properly, and we know how we need to present the warm-up sessions, and we will present the warm-up sessions without any difficulties or without any mistakes. That we know. But what about the role play? It's a new thing that is coming in front of us, and we will be having that tension that how I'll be able to speak and how I'll be able to get scores, and how to get scores and everything. Like we need to know that, because while we speak during our role play card, of course we are humans, we'll be having stumbling, we'll be having humming, we'll be having pauses, and everything will be there. Even now when I speak, I do have humming, I do have repetitions. That is normal, that is a human thing. And make sure these hummings, these repetitions, these pauses are not for a very long time, or it's consistent. അത് എപ്പോഴും ഇങ്ങനെ ഉണ്ട് എന്നുള്ളത് എന്ത് ചെയ്യരുത്, അവരെ അറിയിക്കരുത്. Always make, if they are asking any concerns, if they are asking any questions and you don't know the answer, you need time to think about it, then you can ask the patient that sorry, could you please tell me again, അല്ലെങ്കിൽ could you please repeat it again. You can ask the patient to repeat what they have said, because by that time we'll be able to we'll be able to think about what we need to say. Is that clear? To the same thing will happen from the patient side. The patients will also ask, sorry, excuse me, the same thing they will also ask. So don't get panic when your interlocutor or the patient or the bystander will be saying to repeat anything. Don't get panic. Instead, what you can do is, by taking a deep breath, you can say it again, you can explain it once again to that person. Okay, Hina, from we do have many reassurances, like if a patient is having severe pain, we can reassure the patient by saying, I can totally understand your pain, what you are going through, please don't worry, I can give you some pain management measures, I can provide you some pain management measures where you will find bit relief from your pain എന്ന് പറയാൻ പറ്റും. We can say like that. Or else I can totally understand your situation, I know what you're going through, it's unfortunate to hear that. If we are empathizing the patient's feeling, we need to reassure the patient by saying that we are there for the patient, we will be helping the patient, we will be giving the medication, we'll be doing the procedure, we'll be helping with the procedure. We need to give that assurance that we will be there along with the patient. Is that clear? Reassurance means we are assuring the patient, or we are making the patient believe that we are there for the patient. Clear? So that's what reassurance is. If the patient is saying any concern, you can comment, you can say that please don't worry, it's unfortunate to hear, I'm so sorry to hear, it's hard to hear, it's sad to learn that it's difficult for me to cope up with that, it's so hard to learn that. There are many reassurance words or empathetic phrase what we can say to the patient, and then we can say by reassuring the patient that, but please don't worry, I'm so sorry to hear that, but please don't worry, I am here to help you, അല്ലെങ്കിൽ I'll be your helping nurse, അല്ലെങ്കിൽ I'm going to take care of you, and all those things can be said to the patient. Is that clear to you? Okay, so is anybody having any other concerns? So we were talking about the warm-up session and about the role play, how we can balance both the things. For the warm-up sessions, we will be speaking to fluently, and we'll be having that confidence in our face, because we know what the questions are, we know what the answers are, we know everything. But for the role play, we don't know what is going to happen in the next moment, right? So by that time, what we can do is, we can prepare very well at the 3 minutes preparation, and for the warm-up sessions we can do some natural humming and pauses in between, because since we know the answer very well, we don't have that we will not be having that humming and pauses in the warm-up session. By purposefully, we can what we can do the humming and pauses, and by doing the role play, we do need to make the confidence in our heart that yes, I'll be able to do that, I'll speak properly, and speak correctly, accordingly, and you will be able to speak nicely. And what the next thing that you need to do is, endana, you need to they have given the points what you need to say, so you can fill in the blanks, like we can connect each and every words and say it to the patient, so we will not find it difficult to make any sentence or anything like that. Many of the students is having the problem with the sentence making and all. So if you find it difficult to make a sentence or a fresh sentence, you can connect each and everything and you can say it accordingly. Is that clear to you? Okay, so the next thing that I would like to say is, always follow the instructions of your interlocutor. And for the past many days, the same thing is going on, like the same type of questions, like patient bystander questions. One bystander role play will be there, one patient role play will be there, and many of the cases are non-case, many of the cases are home visit, many of the cases are unknown case. We'll be having 6 set of questions, and they will be providing us the role play cards, and for each person the role play card is different. So in the make sure you are appropriately speaking to the patient. Is that clear to everyone? So what you need to do, in short, what you need to do is, we need to focus on our role plays, we need to focus on our patient's concern, we need to we need to address the concerns that has been said by the patient or the bystander, and we need to start in an appropriate way. Like it's always been said that the beginning should be always good. It doesn't matter what the ending is, but beginning should be always good, because there our confidence starts from the beginning. If we are confident enough from the beginning, we are able to speak properly, then our confidence will be high, and we will be able to speak or end our role play in a very nice manner. So always make sure you are confident enough, you can do it very well, and be always confident. That's the only thing I can say to you. Be always confident while you speak. Don't question yourself, don't doubt yourself, and all these things will be really helpful while you go for your speaking module. And always make sure, if you are having the orientation classes, or if the people, those who are seeing the lives for the first time, there are many lives that we are discussing about different types of role plays. We do have many other lives regarding the last minute preparations, and you can just check on that lives also, where you will find many informations, and you will be able to implement that during your examination time. So always make sure you are confident enough, you have practiced well, and the people who have attended the orientation classes from Tiju's Academy, you will be having your orientation books with you. So please go through the notes and what the tutors have given to you. Please go through it. Please go through all the notes that you have studied or you have got during your orientation time, and you will be able to do a better more while you are speaking in your examination hall. Is that clear to everyone? So I hope this session was pretty well informative to all of the students, all of the participants, and always make sure you are confident, and I know you all will be able to speak properly, because speaking is as simple as it is. We do have the things in right in front of us. We do have the things that we need to say. Everything is there right in front of us. So be confident and speak accordingly. Is that clear to everyone? So I hope this session was helpful. I hope this session was really helpful to each and every person who are watching this live. I wish a very